In our Health Watch report, thousands of people need help to keep their hearts beating normally, but there's a less invasive breakthrough that's saving lives. Local 3's Shelley Botat has more.
Defibrillating pacemakers are typically implanted in and around the heart using wires to transport electrical signals. But when a patient's heart can't handle the wires, there can be significant problems. Now there is a wireless or WISE CRT treatment that is making a huge difference for some patients. 48-year-old Angela Tasby has been having heart problems since 2013. Last year, efforts to attach a defibrillator failed because her blood vessels were too small for the electrical leads. She was facing a possible heart transplant. Today, she is on the road to recovery because of a chip the size of a grain of rice that uses wireless technology to keep both sides of her heart pumping in sync.
It's a blessing. So you don't have any wires you think hanging off of you or anything. Everything is wireless, so you continue on with your daily life.
It is the first device along the way to provide this sort of therapy without having to depend on leads that are mechanical devices that can fail. When this device senses the pacing impulse from the defibrillator, it sends an ultrasound signal that is picked up by the chip that is in her left ventricle and results in both ventricles firing at the same time.
Dr. DeVille confirms that the wireless cardiac resynchronization therapy study saved Angela from open chest surgery.
So the device is doing fantastic. More importantly, you're doing fantastic.
I'm doing fantastic.
Awesome.
I did not look like this at first. You can ask my family, my doctors. It's a miracle, blessing.
A blessing Angela and her husband Roderick are enjoying every day. Not only did the device save Angela from an open chest surgical procedure, all episodes of heart failure have been completely eliminated. And that's your Health Watch. I'm Shelley Botat, Local 3 News.